Cases of whooping cough have been on the rise since last year, and here's what you need to know about it. It's caused by the bacteria Bordetella pertussis that's transmitted through respiratory secretions, and it can cause viral upper respiratory symptoms for a few weeks, and then it can get more severe. And especially for children under 1 year of age, they could have respiratory distress and a characteristic whooping sound that could increase their risk for being hospitalized and having respiratory failure. And so since last year, there were 35,000 cases in 2024, now 25,000 in 2025. There's been 6 deaths last year and a handful this year from this bacterial infection. And prior to the DTP vaccine being introduced in the 1940s, we used to have about 200,000 cases a year in the United States, and about 9,000 would pass away. This is what is also known as the 100-day cough in older individuals. So the DTaP vaccine that we use nowadays is started at 2 months of age, and there are several doses that are given. And then a booster of the Tdap vaccine is given for teenagers and adults every 10 years. And if you're pregnant, it's recommended to get the Tdap vaccine with each pregnancy to provide passive immunity to the babies as they're developing so that they have some protection during the first few months of life. But we have seen a decline in the vaccination rates amongst kindergartners. Prior to the pandemic, about 95% of kindergartners in the United States were up to date on their pertussis vaccines. And now it's gone down to about 92%. So many people will be at risk of getting infected still, which is why it's so important to maintain vaccination coverage to keep these numbers down, to maintain proper hand washing, and to wear a mask in crowded indoor spaces with poor ventilation.